Hello everyone and welcome back to another edition of Physio News Network. I am Giri Srinivasan, your host, colleague and fellow explorer in the ever-evolving world of physiotherapy. In this September edition, we have got a powerful lineup for you. Cutting-edge research, reviews, a brand new clinical practice guideline, an exciting innovation in our field, an effective exercise spotlight, and an inspiring patient success story to remind us why we do what we do. So grab your coffee, settle in, and let's dive right in. Research Review 1, what we're going to talk about is compression overload test versus straight leg raising. First up, a research game changer, the compression overload test, or COLT we call it. Traditionally, we have leaned heavily on the straight leg raise or SLR for diagnosing lumbar disc herniation. It's a classic, but here's a catch. In non-radicular cases, its sensitivity falls very short. So, COLT, in the other hand, the study demonstrates a 92% sensitivity for detecting lumbar disc herniation, significantly outperforming the SLR. So that means earlier, more accurate detection, fewer misdiagnoses, and more confidence in our assessments. Think of it as an upgrading from a flip phone to a smartphone. Still a phone, but with a way more precision and capability. So the second research review we're going to see is about resistance training in pregnancy. Our second research highlights comes from the British Journal of Sports Medicine, looking at resistance training during pregnancy. Now, I know what some people might be thinking. Weightlifting and pregnancy, is this safe? The answer is a resounding yes. The study found resistance training was not associated with any adverse outcomes during pregnancy or postpartum. In fact, it was linked to low rates of gestational diabetes and hypertension, and also reduced risk of perinatal mood disorders and decreased macrosomia. Macrosomia is nothing but big babies. And here's a fascinating detail. Women lifting more than 80% of their 1 rep max had a decrease in preeclampsia risk and showed even stronger protective effects against mood disorders. So, pregnant women, yes, you can do resistance exercises, but please consult your healthcare practitioners and physiotherapists before you start your program so that you can start in the right, appropriate way for your skill level and ability level. So, here's a paradox. Only 25% of the pregnant women meet the recommended 150 minutes of activity per week. As physios, this is our opportunity to educate, to guide, and to empower women during pregnancy, safe, strong, and science-backed. So those are the two research reviews in our PNN today. Next, we'll move on to our clinical practice guideline. Today, we're going to discuss about fall risk in older adults. So, APTA Geriatrics Academy, the American Physical Therapy Association Geriatric Academy, has released a new clinical practice guideline synthesizing the best evidence for community dwelling adults aged 65 and above. Here are the key takeaways. Multifactorial programs. So, screening, assessment, referral, and PT and PTA, physiotherapy assistance-led interventions are strongly recommended. And then, multi-component exercise. Balance training combined with resistance training or Tai Chi has stronger evidence for reducing fall risk. And these balance training exercises should be progressive, challenging, and dynamic. Tai Chi is especially effective for those at lower fall risk. And also, do not forget the environmental assessments and home modifications. They are very crucial for fall risk. And here's the important note. Resistance training alone is not recommended to reduce fall risk. It must be combined with other components, like your balance training and other things. So this guideline is a gold mine for practice. The evidence is quality level 1 and recommendation is really strong. It's not about just preventing falls. It's about preserving independence, dignity, and quality of life. Next, let's move on to innovation segment. For innovation, we are talking about virtual reality and virtual reality goggles in physiotherapy. Yes, those VR goggles are not just for gaming anymore. Clinics around the world are using VR for both orthopedic and neurological rehabilitation. Patients can engage in immersive balance training, gait re-education, or even graded exposure for pain and anxiety. If we are using it at Insta Physical Therapy for some of these things, and it's challenging at the most time, the patient also having a lot of fun. We are also learning every day using VR goggles for ortho rehab and also neuro rehab. So you can check it out. It's motivating, it's measurable, and it makes therapy fun. When patients say, I forgot are you even exercising? You know, you hit a very sweet spot when they say that. The future is immersive and VR is proving to be a powerful ally in our rehab toolkit. Next, we'll move on to the effective exercise for this edition. We are going to talk about tall kneeling turns with kettlebell. So this exercise usually introduced to us through functional movement screening and FMS World with Gary and everybody, Gary Cook. So this exercise, I love it for so many reasons. Tall kneeling turns with kettlebell. This exercise is fantastic for building core stability, hip control and anti-rotational strength. From a tall kneeling position, you rotate the kettlebell around your body while breathing nicely through your diaphragm or your abdomen, not raising the shoulders. This forces your core to resist unwanted movement. It's a very functional exercise, it is scalable and it translates beautifully into everyday movement resilience. So try it and let me know how you feel about the tall kneeling kettlebell turns. Next, let's move on to our success story of the first 2 weeks of September. This is a patient story. So let's call this patient Mrs. C. Mrs. C, I met her a couple of weeks ago, actually 3 weeks ago, who came to us with severe back pain, left leg pain, spinal stenosis, not moving well, even bed mobility was very painful, not sleeping well, not able to walk properly. She also having this nerve impingement, shooting the pain down into the left leg. When I met her first, she's given up quite a bit. She was already on the wait list for spinal surgery. She tried different things, didn't help her. She thinks spinal surgery is the only thing which will help her. So, what did we do? So we did a thorough assessment. Instead of focusing on the pain alone, we worked on a lot of other things. Like, first of all, very effective pain neuroscience education. There was a little denial in the front from the patient side, but then when she started seeing the changes, she understood that. Because she did have quite a bit of central sensitivity. Okay, we talked about how brain can tune up and tune down the pain and how it's not just in the tissues and the joints and the discs and the nerves anymore. Then we could use different modules of pain neuroscience education with her, which was really effective in her case. And she understood that as we went along in the sessions. And we used cognitive functional therapy approach, and also that really helped, just exposing her very carefully and graded exposure to movements and comfort. Good manual therapy, spinal mobilization, myofascial release, and also a lot of soft tissue work. Fast forward, after 3 weeks, she's now 75% pain-free. She's going on long walks now with her friend, and she's very optimistic that she may never need surgery at all. Hopefully, we can get her there. So, stories like hers remind us physiotherapy is not just about fixing joints or muscles, it's about restoring hope, function, and independence. So, that wraps up the September edition of Physio News Network. From smarter diagnostics with Colt to empowering pregnancy with resistance training to fall prevention guidelines, VR innovations, effective exercise, and Miss C's inspiring journey. One thing is clear, physiotherapy is evolving, and so are we. Let's keep learning, keep innovating, and most importantly, keep changing lives. Thank you for tuning in. I am Giri Srinivasan. This has been Physio News Network. See you in the next edition. Until then, stay strong, stay inspired, and keep moving forward. Bye.